Hello, this is Dr. Tom Lewis, your medical scientist, helping simplify often complex and confusing medical and healthcare information. Hello, Dr. Lewis here, and I'd like to give you a broad brush of our 4 Dimensions of Health program. So really, what we have to recognize is health and disease is a continuum. No one's either perfectly healthy or perfectly sick until they die. So we all live on a continuum somewhere along that spectrum of perfect health to death. So it's characterized in 4 dimensions, and the most prominent one and most primary one, and the one you have most control over, is risks. We all have what I call determinants of health, risks, lifestyle effects and factors, environmental influence and factors, your family, your genetics, all these different things go together to create where you are on the risk continuum. Totally modifiable, though, in many, many cases, except for very specific genetic disorders. But even epigenetics, totally within your control. So the next continuum we live on is what I call a biomarker continuum, but it's really what's going on within your physiology. Urine, blood, saliva, stool. We mainly focus on blood markers, but you can have very good blood biomarkers or you can have very poor biomarkers, and it really reflects what's going on internally, most of which is generated from risk. Blood just doesn't turn bad out of the blue. It's risks that create the modulation or changes in your blood biomarkers. The next would be tissue changes. So if you have perpetually bad risks and perpetually elevated biomarkers, ultimately disease is going to start occurring, and the first thing you see are minor to more profound changes in tissue. When we use the eye to look at tissue because it's transparent, we can see it easily. And then as you progress down these continuums, you get on the disease continuum, and disease is simply tissue changes that are now becoming clinically adversely relevant to you. So we have this continuum of age versus disease state, or disease risk. And we have, each of us has a position across these 4 different continuums: risk, biomarkers, tissue changes, and disease. But the important point is that they all overlap. Okay, so risks beget biomarker changes beget tissue changes, and tissue changes perpetuate into disease. So the question is, are you going to approach this from a reactive perspective or a proactive? And reactive is obviously we already have disease and we're going to try to make some changes to ameliorate that. Proactive is working back in this direction to recognize maybe you have a cataract, or maybe you have high white blood cell counts or C-reactive protein, or maybe you know your lifestyle is not that good. So if you make changes here, that's a proactive approach. And that, of course, is the best thing to do. It's early on, and you can have a greater impact on your overall health as you work back this continuum in this direction. So let's look at what they can be, or how you can realize better health by recognizing that you're on all 4 of these continuums, and we can work on these. So if we realize we have risks and we make positive changes, then we head back from high disease risk to lower disease risk. And that'll manifest in changing your biomarkers in a more favorable way, which will manifest in changing tissue changes that are occurring. And we can actually see tissue changes, improvement in tissue changes. In the eye, for example, we've seen patients where cataracts actually start going backwards, regressing. So we see a reduction in cataract burden. That's a very positive change in sort of a pathological state of your health when we see something like that. And then, of course, lastly, if you take care of risk, biomarkers, and tissue changes, we'll see a regression in disease as well. So these are all very positive things. So once again, are you going to be proactive or reactive? And when people are really sick, even when you try to be proactive now, the rate at which your disease state changes is much more slow compared to if we back up along this continuum further and further and be much more proactive. So proactive is the way to be if you're interested in a truly long health span and healthy longevity. So the problem we face is that psychologically we're hardwired for instantaneous gratification. So let's say you feel pretty good, you think you're pretty healthy, and you make all these changes. Well, you may not see a large effect on the way you feel. You've moved a little bit, but not enough to really say, was it worth all that effort? Whereas when you're a lot sicker, you may see more dramatic changes. But it's always going to be easier to stay healthy than it is to overcome poor health. So in the four-dimensional program, fortunately, there's something for everyone. If you're motivated to change risk factors, that's something you can do. If you're the type that reacts and you wait till something's wrong, well, then we have something for you as well. So let's look at what you can do, whether you're of the reactive type or of the proactive type in the four-dimensional program. So dimension 4, we'll start from the worst case scenario. So a lot of people come to me in my program and work with Dr. Carter and some of my medical doctors and coaches because they're sick and tired of being sick and tired. And they've seen a lot of traditional doctors, and the way they've dealt with being sick and tired is with medications, and they've solved some symptoms, but they really haven't solved the underlying problem. And you well know that. So you're looking for something that's much more focused on the why of health. We work to solve the why. Being a medical scientist, that's really what my brain is hardwired for, is find out why something's going wrong, not just the what, and solve the symptoms. So dimension 3 is looking at tissue changes, and we use the eye. It's a simple eye exam, and we're looking for pathological changes in the eye, tissue changes. So if you get to that extent and you have an eye complaint, well, I would say that's both reactive to some degree because we already have tissue changes, but it's also proactive because your disease, a lot of times the eye is a canary for damage and tissue changes in other parts of the body, like in your vessels or in your brain. The eye is an outcropping of the brain, by the way. So once again, we don't just treat the eye. We use the eye as a screening tool to indicate there are tissue changes and then look more holistically to see what's going on and answer the question why and solve your problem at that level. The next one I consider much more proactive, especially if you feel pretty good and you're doing blood labs. Unfortunately, in the standard of care system, it's very difficult to do what I would call a robust set of predictive blood labs. Sure, you can get your cholesterol and your A1C and some kidney and liver tests done, but they're not really that proactive looking at smoldering disease. We want to look at inflammatory markers like C-reactive protein, homocysteine, fibrinogen, sedimentation rate. If you're not aware of what those are, look for future videos on this topic. So once again, if your C-reactive protein is up, an inflammatory marker, the question is why? We want to dig into that. And guess what? In most cases, the why is answered by where you are on the risk continuum and what factors are bringing you further and further up that risk continuum that can then lead to physiological changes, pathological changes, and disease. So this is very proactive, and the why can be anything from nutrition to oral health to sensitivities, things of that nature. Nutricogenomics, how you're interacting with food, a lot of different factors that can influence how risks manifest to then lead to physiological, pathological changes, and then ultimately to disease. So it's a very simple system. It's 4 dimensions of health. We all live on a health-disease continuum, but within that there are 4 dimensions, 4 continuums. Risks, physiological changes, pathological changes, and ultimately disease. And I hope anybody listening to this video will consider working with us and looking to ameliorate where they are in the risk continuum and improve their overall health for a healthy longevity. Dr. Tom Lewis here. Thank you very much for your time.